Alaikum mashallah ala Korea hote.
Hi everyone, I am Tara, aka Spirit Mother, and I would like to welcome you all back to my channel on YouTube, Spirit Teaching of Going Through Self, on TikTok, 1974 Lit Soul, and I'm also live on my Facebook. If you're new to my channel, I always recommend, suggest, and really encourage you to read the description of my YouTube channel, Spirit Teaching of Going Through Self, to get a better understanding of what it is that I've been going through on my channel. And as many of you know, there's a lot of my own life experiences that I also listen to. I scroll TikTok. I listen to people in their everyday life. And I observe a lot. And I speak out about it. Some people may get offended by me speaking out about it. Okay? Irritated because sometimes it has to do with their life, but I can totally relate and understand it. Okay? Because today I'm talking about doctor-patient relationship. And I just saw that glitch on my TikTok where it took a big flash. Okay? So I'm talking about doctor-patient relationship, as you all, some of you have experienced that, where, you've gone into the doctor and you brought things forward to the doctor, but you felt very dismissed, unheard, okay? It's a breach of trust, right? But who mostly is the one breaching the trust of the doctors? Because, is a patient not supposed to be part of their health care? But when you question a doctor, you get flagged. You get snubbed. How dare you question me? Because, I'm going through a situation like that right now, not for myself, but, someone I know, okay? And I was at their place, and we were talking, and we were explaining, asking me, mentioned it to the doctor, and the doctor gave me a prescription for nose job. You often wonder, okay, many people have the same symptoms, right? And they're handed a prescription. Here's a prescription, here's a prescription. But yet the prescription really doesn't do anything for you. See, prescriptions were never supposed to be a lifelong thing, but they turned it into. And it's, whether you believe me on this or not, for like new prescriptions, when you're sitting in the doctor's office and somebody comes in with a little medical briefcase and they got all kinds of new drugs coming out and they get to go ahead of you to see the doctor. Do you know what that is? Many of you do. They're going in with their trial drugs. Okay? For every trial drug that your doctor uses on the patient, they get an incentive. That's fake. That's false. That's a conspiracy theory. I did the research on it. But you'll look at me like, hey, I don't know what I'm talking about. I've experienced it. Okay? I even told my doctor that, there's stuff in my file that is incorrect. That was the doctor that I had, but I actually dropped him after that. Well, what am I supposed to do with it? Well, you're the doctor. You're actually supposed to correct it. You've been my doctor since I was freaking 4. So you know that it's not true. But if there's any work to be had, most of them don't want to do it. Because the easiest thing is to write a prescription or write a requisition form. Here, go get some blood. Here, go get a test. Because that's what they said this person. I sent for a lung test. Right? Now, you know, maybe people know who I'm talking about. Go lab. You might want to watch this. Really, okay? Because in reading what I found out for them to take to the doctor, it pertains probably to a lot of you because I know it pertains to my mom and it pertains to my ex-husband. And you know, maybe ask yourself: are you having eye problems? Are you having nose problems? Are you having dryness of the mouth? Are you having fatigue? Are you having symptoms of inflammatory and arthritis? Because if you are, you know, maybe you should ask your doctor about this because I'll pretty much guarantee that this is probably a lot of most people's problems. But if you question your doctor, you are a problem. How can you be a problem if you're supposed to be part of the whole system? Oh, right.
We have the diploma on our wall to say that we took years of experience in order
To write you a prescription.
well, I do know how to read and I do know what you're doing is wrong.
But how are you going to justify it being right? Same. All doctors are freaking quacks and pill pushers. But a big majority of them are. At least the ones I've ran into. And let me see, I've had quite a few family physicians. Not only family physicians, but you go into the emergency room here. Take a pill. What? What am I taking a fucking pill for? You don't know what's wrong with me. You're just guessing. I can too. I can go read. But am I guessing? No, I'm actually using what's called common sense. Like I said, if you don't understand the language, then you know, then my channel is not for you because it's going to come out. Because it's not just you I'm speaking. It's many different forms of people, different backgrounds of people. And hey, you know, what is this? Mary Magdalene feast day. So let's have our feast. Okay, so you know, hey, like I said, I even sent this to my husband, you know, whether he read it or not, but you know, hey, you think I'm stupid, really? You really better go get your fucking head checked. Okay. Sjogren disease. Sjogren disease. Oh my gosh. That was putrid. I damn near, oh gosh. Oh, what is it today? Okay. Sjogren disease is a symptomatic autoimmune condition where the immune system mistakenly attacks moisture-producing plants. It primarily causes severe chronic dryness in the eyes and mouth alongside profound fatigue and joint pain. It predominantly affects women over 40, either on its own or alongside other immune diseases like lupus. Core symptoms. Well, dryness of the hallmark Sjogren's affect the entire body. Common symptoms include voice. How many of you get eye burning, itching, light sensitivity, and constant gritty sensations? Which can lead to vision issues if left untreated. So, how many of us, as a collective, because I know there's many. And there's more than one in this audience right now. My ex-husband, my mother, my father, my sisters, oh gosh, my mother-in-law, ex-mother-in-law, God rest her soul. Which, ironically, it also, causes scleroderma. We'll get to that. Okay. Untreated eye issues. So now we'll go to the next one. Mouth. A cotton-like feeling, difficulty swallowing, loss of taste, and significantly increased risk of dental cavities and yeast infections. Sound familiar? Seriously. Sound familiar? It doesn't take a fucking rocket scientist or a genius to be able to read and understand this shit. That's why many want the internet to go, because, you might be able to figure out what's wrong, because there is actually a prescription you can take without taking all the fucking eye drops, because most people struggle to get eye drops in their life. And they get irritated putting stuff up their nose, or, you do mouth. Go buy your biotin that costs what, almost $15. That's chem stick. You'd think the dentist would even know this. Doctors, right? At least you perceive yourselves to be doctors. You brag about how you went to school for many years and you got your fucking diploma and, you got a license to prove it. Just to put in, man. Seriously. I may be an asshole and a bitch sometimes. You like me, love me, hate me, loathe me. I'll make you laugh, I'll make you cry, I'll piss you off. You'll even want to punch me upside my head. But hey, keep your hands to yourself. By all means, bring it energetically. But hey, I get itchy eyes. I got the lack of smell and taste. I could give you a prescription. I guess it's one of two, but we'll get to that, okay? Why can't I give you the because the majority of the time people's prescriptions are covered, correct? But if you're continuously taking something from your nose and your eyes, and how I came to this solution, to this diagnosis? I Googled to find out about the tear ducts in your eyes. Because I asked the person, like, hey, does your eyes ever water? Are you ever able to cry? I feel like we're at a barf. Like it's right here. Sorry, am I too gross for you? Well, like I said, my channel's not for everyone. Loss of taste, significant increased risk of dental cavities and yeast infections. Systematic issues, chronic fatigue, brain fog, generalized joint and muscle pain, dry skin, and vaginal dryness. Oh, huh? How many of you have those symptoms? Men might not have the vaginal dryness, but hey, I'm not talking transgender. I'm talking about the ones with the vagina. Take offense to it all you want. I really don't give a shit at this moment. In some cases, it causes dry cough, lung inflammation, periodontal, periodontal, no, periodontal hernial, neuropathy, or vascular inflammation. Bring a motherfucker to suturea. Sir, no, please excuse me, or not, that I have no real respect for your so-called doctors that say and brag about their certificates. The simplest thing. But this person's doctor, they said they took it to, they informed them about it. Whether they did or not, I don't know. But who's the incompetent here? Because I'm sure the fuck it's not me. Causes and risk factors. The exact cause is unknown, but a combination of genetics and an environmental trigger like a virus or bacteria is believed to spark the immune response. It is classified into two types. You know, what's going on in the world right now? There's a lot of environmental issues, right? But you know, they'll say it's climate change. No, it's actually human stupidity. You know, patients are supposed to be involved in their health care. But the doctor removes you right from it because they think you're incompetent and you're stupid and you know nothing. And then if you read something, oh, wow, 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 wow. Hey, wait till we get to Mayo, Cleveland, you know, because I have it on medical websites, right? Ain't that where doctors get their information? They do case studies from medical facilities. Hmm, I can't be wrong. But it's not like I can't be wrong about that. I know I'm not. Sjogren's disease, SJ, if you want to look it up, SJOGREN apostrophe S disease is a symptomatic autoimmune condition where the immune system mistakenly attacks. Oh, how did I get back there? Oh, okay. Primary SJOGREN apostrophe S occurs on its own. Secondary Sjogren's develops alongside another rheumatic or autoimmune disorders such as rheumatoid arthritis and scleroderma. Diagnosis. Because symptoms mimic other conditions, diagnosis are often requires a combination of physical exam, blood test, checking for specific antibodies such as anti-SSAs and anti-SSBs, and sometimes a minor saliva gland biopsy. Raise your hand if you have all these symptoms, and what's the chances that it's something minor and not something major? I had a doctor tell me, oh, well, you know, there's so many things that go undiagnosed. There's no explanation for them. Well, there's a very good explanation right here. But those are tests, right? Because those would be the common sense factors to check first. They always say about common sense that they use them. Am I insulting your intelligence? with all due respect, just because you have a certificate doesn't mean it makes you intelligent. It just makes you easy to program. I'm not like poo-pooing your credentials. I'm saying, why not check the simplest things first? Oh, wait. Because there's no real money involved. Treatment and management. Well, there is no cure. Symptoms can be effective to manage. Treatment focuses on replacing lost moisture and claiming symptomatic inflammation for dry eyes. So here we go. Over-the-counter artificial cures or prescription eye drops such as cyclotine or Liferist. Okay, so go feed the system, right? Dry mouth, frequent water intake, sugar-free, lucozade, and prescription medication like prolactin and cevimeline to stimulate saliva production. For systematic system, anti-inflammatory drugs or anti-supportive medications to target widespread joint and organ inflammation. You know, you can actually catch this before it gets started. First off, by listening to your patients. I know someone who used to, like, my ex-husband, he used to snore a lot. Like, I mean, when he snored, when he was snoring, he sounded like a fucking demon in the house. Anybody ever watched that movie, Little Nicky, with Adam Sandler? When he's sleeping and he's doing the snoring, that's what my ex-husband sounded like. Okay? And he had things removed in his skin. Like the air I'm breathing. What are you doing every day? You're breathing in, right? But it's going in your eyes, it's going in your nose, it's going in your mouth. So the best way to solve this is by addressing the actual problem, which is the environmental problem, instead of creating more. But like I said, either way you look at it, to them, there's no money in it. They all have the capability of changing the downside effects of the environmental stuff, but they choose not to use it because they keep telling you, we need your donations, we need your donations. I watched a man today, he said, oh God, why does God allow cancer? Why does God not cure cancer? God works for people, right? So if God works for people, back in the late 80s, there was actually a news broadcast on CTV News where they actually had a viable cure. But because there was no patent on the drug and the drug was only pennies, Big Pharma wouldn't foot the bill for the experiments. Well, to do the trial because it was actually working on rodents. Okay. Big Pharma wouldn't, but they said, you know, the government was actually looking into supporting it and helping it out. Where'd that come? It just vanished, right? It was actually University of in Alberta that a doctor there had found the cure. So this is your doctors working for you. This is your scientists working for you. And okay, people with children require regular dental and eye exams to prevent complications, as well as routine checkups with a rheumatologist. Wow, lots of money there. Work it out, 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 work it out. Holy shit, look at it all go! Woohoo, we're rich! Are you offended? Not me you should be offended by. It should be the ones that you go sit with. That keep telling you, oh, well, you know, we're going to send you for some tests. More money because you know, hey, when I went for the test, when I busted when I broke my collarbone, but the doctors kept all trying to tell me that it was mental. Well, the doctor there put his hands on me and said, hey, now, Carol, because they did a CAT scan. And they said, well, that's, you know, we just performed it, we just did the most expensive test on prove that because I actually have a video from that day. Istituto Politico Moshe, right? And I know my face is turning red. You're so angry. Well, you know, and unfortunately, you're not. Oh, wait. That's not true. Really? Did you ever take the time to look up the information that it's bringing forward? You know, read it and I print it off.
I feel like I'm gonna barf. Okay. Let's see. Other areas of dryness can extend to the skin, nose, throat, and vagina, causing pain during intercourse. Well, hey, it's been 4.5 years, so I guess I don't have to worry about that. Causes and risk factors. The exact causes are unknown, but it is immune response, meaning your immune system mistakenly attacks your own healthy cells. It can develop on its own primary or alongside other immune conditions like rheumatoid arthritis or lupus. The secondary, it predominantly affects women, about 9 out of 10 diagnosed cases. How's your menopause working out for you? Is it possible that could be? Okay. Do they antidepressants, a different medication on your what is it on your TV? Huh? Oh, go to your doctor and ask your doctor for this medication. Oh, I thought they were the doctor. If they're the doctor, why the fuck are you advertising it? Do you ever notice like doctors write jargon in language that layman like you and I don't understand? Why do you think that is? Because it's something so simple, but they want to sound intelligent. Take offense to it. Diagnosed causes and typically appears in people over the age of 40. Disease is a chronic immune disorder where the immune system attacks the glands that produce moisture, primary tear and saliva glands.
Dry eye, got dry eye much? Better go get your eye drops. You know, I know someone, they tell them to use eye drops, but they can't put fucking eye drops in themselves. They're supposed to use it every day. You know, my channel is not for everyone, especially for the ones that aren't ready to understand and wake up yet. Or maybe it is for you, and you just need to sit a little longer before you get something.
It causes persistent dry eyes and dry mouth, along with widespread symptoms like severe fatigue and joint pain.
How many of you have fatigue, brain fog, joint pain? You know, they make it, oh, we got to do this big brain scan. Well, hey, you know, how about you avoid the brain scan? Because every time you go get a brain scan, it affects you to the core. But you won't believe me on that, will you?
Key signs and symptoms: the burning, itching, and gritty sensation, like sand in the eyes, and light sensitivity.
You know, how many of you are saying, oh, my eyes are so sensitive, my eyes are so sensitive, but the doctors can't seem to find a problem with them. Well, we'll see. Go get your glasses now. Meanwhile, it's getting worse for us. Hey, I cry all the time. Not because I'm a big baby, but I do a lot of work and I listen to a lot of on TikTok and just in everyday life. Which is something that most doctors don't do with their patients, because if you question, they get irritated with you and they end you. Here, take this prescription here. Like here. Go ahead. Here, take this. You know, come back in a week or two and let's see how it's working out for you. Oh, that's not working. Oh, let's try this. Meanwhile, we're all counteracting with one another and creating a bigger problem. Right? What, you're going to say, oh, you're not a doctor, you don't know this stuff. Okay. If they're not checking this before they go get you a fucking big brain scan that costs you, the taxpayers, shit piles of money, and if there's shit in the States, like shit piles of money, to have it done, well, hey, I guess you got the money, right? And hey, you know, don't complain about the medical system because you're taking money. So if you're not going to take, it's not advice, it's information that I'm bringing forward that, you know, maybe you didn't know about, or you just didn't think to ask the questions. But my question is why? Why not confront your doctor? Because everybody says, oh, because I won't have a family doctor. Well, I'll tell you right now. In all honesty, fuck the family doctor shit, because they don't know you for the most part anyways. They just pretend they do because they're counteracting medications all the time. You know, there are some doctors. But hey, the best way is actually to be able to go to the doctor when you need it. So you walk in. But instead, because they say, oh, well, there's no real money in the walk-in clinic, so we gotta have a family practice, and then we gotta overlap our appointments, because I know people who, you know, went in for your appointment, but there were 3 or 4 other people that had the appointment at the same time for the same doctor. How the fuck does that work? Are we all doing it better? Isn't that overbooking? And then you say you're exhausted. I'm talking to the doctors on that. You know, there's no family dog. You say, oh, there's no family doctors. People who can't get a family doctor, they can't get into the walk-in clinic because now those are appointments. You can't just walk in and they're going to have an appointment. You got to call the day before, or really early enough. And if you can't get there, well, you're told, oh, we'll just go to the emergency room because you got a sniffle. My advice to you, if you got a sniffle, go hop in the fucking tub. Steam yourself. Drink some chamomile tea. Get some rest. You go into the doctor and you see people and you're wondering, like, the doctor where, you're told, oh, you can't get a quick job, but yet you go in and there's like two people sitting there. Oh, right, because they're doing home calls now, which they make an appointment, but they call you when they want. And then they get like, what is it, $28 for 5 minutes? They do, because I looked it up. So anyone that wants to tell me, I know what I looked up. Oh,
Yeah, I knew that one tonight. Because it's called cross-reference. I'm using some common sense. Because the simplest things are usually the first problem. And when you don't address it while it's simple, that's when that's when it gets attributed and it becomes something, as it says on the list. That's true. I know someone that, they had a hernia. They had a bad one. Like they would scream. And I would see it happen. The doctor, oh, just go home, just go home. It's not bad enough. But yet the surgeon that did his surgery for the hernia said that it's always better to get it early because it's less complicating to do surgery on. So who's the incompetent one? It wasn't the surgeon that told the person this. It was the doctor that kept prolonging it. More money in your pocket, huh? More prescriptions you get to write for pain. So primarily tear and saliva glands. Well, your tears, what happens when you cry? Not only does the tears clear your eyes, but it clears your nose, right? Because you start snotting. Your nose starts running. Have a good cry. See how you feel afterwards. Hey, while I was there, I even did a thing with the person where I did their blood pressure. Them sitting still, after I get in there and we were talking, them sitting still, I did the blood pressure 142/73. So I told them, you might want to talk to your doctor about that. No, that can't be right. That can't be right. So took it again. Well, I was taking it. He was stressing. The person was stressing. Blood pressure, 202/182. So after they stressed and then they got angry and released some frustration, I did their blood pressure again. 128/80. So what happens after you have a release? The same person, they even said, like, they don't even check your blood pressure or anything like that when you go into the doctor now. Just what are you here for?
Why don't you just come out and say, oh, and what prescription can I write for you today? How about you do something to address the Sjogren's disease? Go to the next page. Okay, now let's see. Let's see here. This is a video about Sjogren's disease. John Hopkins.
Sjogren's syndrome is a multi-disease which encompasses targeted primarily salivary and lacrimal glands, those glands that make tears and saliva, and as a result, it leads to tremendous damage to the eye. But it's also systemic, so it also affects other organs, tissues, so it has complex produce joint pain, arthritis, affecting organs, making it very common to get brain fog, cognitive difficulties, so it has a variety of systemic effects. Issues. The ratio of women to men is more than 10 to 1, so it really is a disease. So dryness of the eyes and mouth, hard, so it also affects causes dryness also, such as the skin, vagina. So patients with Sjogren's do get other diseases, sometimes it's thyroid disease and liver, forms a lot of liver disease, but also they often get Sjogren's in the context of another rheumatic disease, for arthritis, lupus, or sclerosis. So it actually is the most common autoimmune disease to be associated with yet another autoimmune rheumatic. I think there's been a problem. There's often not diagnosed. Symptoms of dry eye and dry mouth are very common in the population. So a lot of people have this. And when they come across a condition, think, oh, it's their patient voice dry eyes and dry mouth. So the symptoms are quite non-specific. The testing that's required to diagnose those symptoms is actually pretty complicated. It may require blood testing, additional biopsy of it. Hard to obtain with proper.
Sticky helps me.
It's often been asked I think the answer is clear. Patients who live with this disease have included maybe much worse. So they're not really worse. And some people have much more systemic flares. They're not really blue, so they have much more joint pain, they have rash, all that saliva. The manifestation. So it can flare. It's not disease that flares in a way to flare of other rheumatic diseases. Most patients are stable, common, does not fluctuate that much on a day-to-day basis.
Okay, so now we'll go to another one.
Sjogren's syndrome.
Curative
And bad signs of Sjogren's syndrome
very complex disease.
That I see in
Almost
my
13 minutes
practice
long.
without alcohol. So today I decided to give you all the information you need to understand this disease better. And in video, we will discuss the most common 10 manifestations of Sjogren's syndrome. Let's begin. Hi everyone, I'm Dr. Yamata, a board-certified rheumatologist and the founder of Rheumatology Support. If you're new here, welcome to my YouTube channel where I educate people about autoimmune diseases like Sjogren's syndrome or rheumatoid arthritis and many others. So don't forget to subscribe and never miss one of my videos. If you have been following this channel for a while, I'm excited to have you back and share more information with you. Sjogren's syndrome is a rare disorder affecting approximately 1% of the population. Between 400,000 and 3.1 million adults suffer with Sjogren's syndrome. Females are more affected than males, and many patients with rheumatoid arthritis actually have symptoms of Sjogren. Dryness. The most common symptom of patients suffering with Sjogren's syndrome is dryness in the eyes and the nose. Patients often describe dryness of the eyes as itchiness, irritation, grittiness, or a foreign body sensation, and sometimes blurriness or even change in vision. The lacrimal gland secretion from your eyes will decrease over years and you will start feeling these changes that can become pretty upsetting. Suppose you go to see an eye doctor. In that case, they can quantify the secretion from your lacrimal glands with a test called Schirmer test, where they would put a special paper in your eyes that can quantify the secretion that comes from the lacrimal glands. So we don't even run in the mouth. Also, very common your saliva. Your mouth has your saliva secretion you may experience frequent tooth decay and multiple cavities. You may also experience difficulties when you chew food, when you swallow food because of lack of saliva. You may need to drink frequent sips of water to be able to talk or to be able to swallow. You may have changes in your taste due to lack of saliva. Some patients can develop episodes of parodontitis. Dryness can also affect your skin and that can cause itchiness. Rarely, the skin can develop a more difficult or a more complicated disease called small vessel vasculitis. Some females will describe even vaginal dryness, irritation, pain with sexual intercourse, which can dramatically affect their sex life. Joint pain and muscle pain. Patients with Sjogren frequently complain of joint and muscle pain, and joints can hurt without being swollen. Usually, the pain is symmetric and it may come and go. Unlike rheumatoid arthritis, Sjogren patients have
Wait a minute. Who just tried to get me restricted in the violation? Grow the fuck up, I'm telling you right now. Grow up. Seriously. What, you're okay watching somebody be on like be beat up on your TikTok? TikTok allows that and there's no community violations there, your other clubs. What? You bring forward truth? Did you get funded? Grow up. Because that just shows that truth is being revealed and you can't handle the truth and you're angry with the truth. Go away now or grow up.
Authorities that will not work their voice. The parents, the kids, and the news can be affected. About 40% of patients with Sjogren syndrome can have a cumulative sign of test positive, especially if they complain about joint pain. More rarely, patients could also have a positive anti-CCP antibody, which is a test that we see positive in patients with rheumatoid arthritis. In that case, those patients could have even erosions in their joints. As I mentioned, muscle pain is also frequently seen in patients with Sjogren, and sometimes muscle pain is associated with weakness that is called inflammatory myositis, lung disease.
You know, my mother smoked, but I know somebody who smoked a heck of a lot more than her, and for a hell of a lot longer than her. She died from COPD, but she complained a lot about her eyes, her nose, and her throat, and dryness in her throat.
About 20% of patients with Sjogren, they can have lung involvement. Patients can develop upper respiratory infection like sinusitis, and they can also present with a dry, irritated mouth. The mouth could be due to severe lung inflammation. It can also block to reflux from Sjogren. Sometimes the patient can see changes in their voices and they can describe voices. In some patients, along with dry cough, patients will present to the doctor with a severe shortness of breath that we call dyspnea. The shortness of breath can initially affect you after walking for a period of time or going up the stairs, but it can also happen at rest. Pulmonary function test and a high-resolution CAT scan are indicated in those cases. The CT can identify if you have lung fibrosis or what we call interstitial lung disease. Some patients will present with shortness of breath and cough before developing dryness in the eyes or dryness in the mouth. In this case, the pulmonologist that found the lung fibrosis might decide to test you for autoimmune diseases like Sjogren or rheumatoid arthritis, just to name a few of the causes, autoimmune causes of lung fibrosis. Neurologic manifestations. Many neurological manifestations may occur in patients with Sjogren, from peripheral to central nervous system manifestations, from frequent headaches to paraplegia or tingling in the hands and in the feet, sometimes in one side of the face or other parts of the body, to more complicated situations like transient myelitis or optic neuritis, which is an inflammation of your optic nerve. Some patients can even present with symptoms that look like multiple sclerosis, and rarely patients with Sjogren will present with brain inflammation that we call encephalitis. Heart disease. Yes, Sjogren can affect your heart. Chronic, ongoing inflammation can increase your cardiovascular risk. What does it mean? It means that you can develop heart attacks, fluid around the heart, arrhythmias like a heart block, or hypertension, or strokes, or even thrombosis where seen or where reported.
Are you awake yet?
Syndrome. Gastrointestinal tract. Patients with Sjogren can also have difficulty swallowing the food because of the deep saliva pool, and they can develop nausea, abdominal pain, and gastritis. Some patients can have liver function changes. Some patients can develop primary biliary psychosis or some form of autoimmune hepatitis. Celiac
I know
was
someone having a problem
also
with liver rate.
reported in patients with Sjogren.
Are you awake?
Kidney involvement, interstitial nephritis, and kidney dysfunction due to acidosis were seen in patients suffering from Sjogren. Patients develop an increased frequency of urination. They have to wake up and urinate at night, which will affect their sleep. And some of the symptoms can be confusing because the patient would think that they have a urinary tract infection, which in fact is not the case because the tests come back negative. And actually, for the patient that developed kidney problems 5 years before she developed blindness, alive. Depression, and why they cannot keep up with their family, and that would be depression. And depression is most likely a response to this chronic inflammation. And some researchers actually believe that depression is a consequence of this inflammation affecting the brain. Many patients with these symptoms will be diagnosed with fibromyalgia when in fact suffer from Sjogren symptoms. Hematological manifestations. Patients with Sjogren can develop anemia, low blood vessels, elevated gamma globin, cryoglobulinemia, and they have increased lymphoma. Anemia is most likely caused by chronic
Rheumatologist.
Especially IgG, are
Doctors will send you to a ears, nose, and throat specialist. Wait, let me pronounce that. What she just said.
seen in about 60% of patients with Sjogren. And these patients will also see elevated rheumatoid factor and positive SSA and SSA antibodies. We will talk in another lecture about the blood tests that we need to follow in Sjogren patients. In patients with monoclonal gammopathy, meaning there are certain abnormal proteins in the blood, we need to carefully interact with you because there could be an increased risk for multiple myeloma or lymphoma. These are two types of blood cancers. Lymphoma. Patients with Sjogren syndrome have an increased risk for non-Hodgkin lymphoma compared to patients that do not carry this disease. The prevalence of lymphoma increases with time. For example, following diagnosis was 4% during the first 5 years of disease, was 10% at 15 years following the diagnosis, and was 18% at 20 years following the diagnosis. So if you notice skin changes, enlarged lymph nodes, enlarged salivary gland, you should call your doctor immediately. As a rheumatologist, I educate my patients extensively about all these changes, so I do follow them regularly. If you want to learn more about Sjogren and other autoimmune diseases, please watch my channel as I will continue to share my knowledge. Remember, these videos are just for you.
The difference between a rheumatologist and an ear, throat, nose specialist.
rheumatologist and ears, nose, and throat specialist. Let's go to the start. Okay. The first thing they do is send you to a neuro specialist. At least that's what they've been doing to the people that I know. The difference between a rheumatologist and ears, nose, and throat specialist. A rheumatologist diagnoses and treats systematic immune, autoimmune disease, arthritis, and musculoskeletal conditions affecting joints, bones, and muscles. So why is it that there are so many ears, nose, and throat specialists for oncologists? Focuses surgically and medically on disorders of the head and neck, specifically specializing in ears, sinuses, throat, and vocal cords. Seriously, why are they sending you there when it's an autoimmune? It has nothing to do with the head. Does it right here? Has nothing to do with the head. So why is it they're sending you to an ears, nose, and throat specialist and a rheumatologist, which is trained in that? Don't you have it like fucked up? Like, do you really know your medical field? Or which is more profitable? But in your nothing, but it should be a rheumatologist, one that deals with, the musculoskeletal. And as they say on there, it's all about learning how to read, but people just want to go in school. You you learn what they teach in school. You don't go above that. But where I'm getting this stuff, that's the stuff that they learn in fucking medical school, right? At least it's supposed to be. And my body is about to evacuate of one end right now. I guess your ass wants to speak. Rheumatologist overview. What they do: manage chronic inflammation and systematic autoimmune disorders, lupus, rheumatoid arthritis, gout. They rely primarily on medication Say, oh, well, that's more medication. Okay.
And to see one. For symptoms like unexplained joint swelling, chronic joint and muscle pain, systematic fatigue, or abnormal blood work indicating an immune autoimmune response. Well, that's true.
That's like that's exactly what she was describing there. The dry eyes, dry mouth. You know, I'll ask you again what happens when you cry and you have tears, right? Some people cry and they don't get tears, so others think it's okay. But you know, hey, each to their own. But some people don't get tears. But if you're not getting tears, you're not clearing your nasal passages, right? Because whenever you cry, go sniff it up. If you can't cry because you got fucking empathy, go sniff it up. I heard her go sniff the dirty clown's ass. That'll show clear sinuses for you. If it doesn't, just still feel good.
Resources explore conditions treated via the American College of Rheumatology. ENT specialists overview what they do: treat, manage, and surgically correct structural issues, infections, and cancers of the head, neck, and throat. C1 for conditions like chronic sinusitis, hearing loss, vertigo, chronic sore throat, tonsil issues, and sleep apnea. They're getting checked for sleep apnea.
Yeah, that's what it's fucking annoying to get put that damn thing on your face like that. Because, you don't check what to do it, right? Please tell me the result. If you're not even putting this as a consideration first, unless somebody knows that they can do it as something or the I'm using that as a drastic measure of what it's saying that it's for. You know, brain injury. I had one, but it wasn't the doctors that helped me. I give all the credit to spirit, to the God, to what you call extraterrestrials, because I know that they took whether you believe it or not, black all the time, ship. You know, there was four of them, and they were like 5 foot. They were 5 foot ones, and they had the longer painted faces, and they had the big black eyes. But they were gray in color, but they also looked like they had a really thin scoop that I could see. And that was when they were working on the back. They were working on the back of the back because after that, the neck was getting better. They were trying to connect with me. So yeah, they freaked the shit out of me. So wherever I was, I jumped over there and I was in the woods and I was back to my bed. And there was another one where they had me laying on this, it was not a bed, but it wasn't really high off the ground, but there were like 7 or 8 standing around. And they looked humanoid, but I couldn't see their faces because their faces were so fucking bright. It was like it was like the face was a donut hole. And that's when everything else started. I went on and I terrified, like did one of those things just on the computer. Pick apart or you ask what it is you want to know about, so it was help. And when I did that, I gave money because I thought I was receiving something. I never received anything through email, but I went to bed that night and I went back to shamanic, like it was like shamanic woman. But when I went out, there was nobody there. It was in the middle of the night. I didn't have any music on or anything like that. It was like I was hearing it. And that went on for days. And And that's when I started speaking different languages. That's when my body started healing. Okay. ENT specialist, okay, mental head, neck, throat, when to see them, sleep apnea resources, find a practitioner or check to do American Academy of the overlap. In some cases, the two fields cross paths. Autoimmune disease managed by a rheumatologist like Sir Judges syndrome or vasculitis can cause localized conditions such as severe joint sinus inflammation or cartilage damage. Patients are often managed by both specialists in these scenarios. Well, basically, what you're looking at is you should be being sent to the rheumatologist before you get sent to your specialist. That's how I do. You go from the more possible. Because how many of you have gone to the ears, nose, and throat specialist? They keep up nothing, nothing. Oh, we found nothing, we found nothing. But yet your symptoms continue to persist. If you can share what primary symptoms or parts of your body are causing concern, I can help you understand which specialist. So please, why is it that they send you for the worst case scenario before they send you to something that could be so simple that they say, oh, well, there's just no diagnosis? Well, obviously, yeah, there is. So that's where you would be incompetent. Because, hey, anybody that enjoys this can find anything in your specialist go here to find something. Well, hey, who's liable for that? Who's liable for the pain and suffering, the brain fog, mental fatigue, and the depression, and what's keeping you from being able to live a productive life? Because it's not you who's to blame. It's the ones who see that it's like yet. Dismiss it and get irritated with you because you question their methods or motives. I questioned one of my doctors. Well, I didn't really question her. I asked her to send me for a PET scan. We're all entitled to a second opinion, right? She didn't have to pay for the PET scan. I was the one paying for it. All I needed her to do was sign a requisition form and say, hey, yeah. But instead, I had to go to Alberta to a doctor there, get sent to fucking Toronto to get the test done, not once, but twice. Back to Alberta and back home. And when I got back home and I tried to get the results to my doctor, she brought me as a patient because she said it breached trust. Yeah. You were the one in violation of that because I went for a test that I paid for, and you brought me as your patient because I asked for a second opinion, and it was no money out of your pocket, it was no money out of the system's pocket, it was no money of mine. have the PET scans, I have the X-rays, I have the MRIs, and I have the CT scans. Let me see that in it's happening in the belly. Yes, you know, the boom, right? The sacral. Okay, the Society of Canada, or the surgeon, you know, they explained it. Syndrome happens when your immune system damages the glands that produce and control moisture in your body. The most common symptoms here is Cleveland Clinic. You know, they use a lot of case studies in universities. Just like moisture in the body, the most common symptom is chronic unusual dryness in your eyes, mouth, or vagina. A healthcare provider will help you find treatments that manage the symptoms and how much they affect your daily routine. How many women have told the doctor, hey, I'm dry down there, and when I have sex because I can't get wet? Many, right? Oh, let's go send you for a fucking biopsy. Let's go shove that clamp up your woohoo and spread it. Gisaturiana! Here, let me ram that up your goddamn fucking hole and spread it. Not just a fucking finger. Because they don't use small ones either. They like some of them like punish, like when they're giving you a ring job. Yeah. Sjogren syndrome is an autoimmune disease that makes your glands produce less moisture than they should. It causes chronic long-term dryness throughout your body, especially in your eyes and mouth. You know, cotton mothballs. Maybe that's why I like, well, they say that's why your teeth decay. Maybe that's why you can't have that. If we got that breath, how would you talk to the doctors about that? Told you to listen to the patients when you speak. Instead of cutting your ears like the children. I love it. Don't question me, I'm superior. I will question you. And you know this. This disease is pronounced Sjogren's syndrome. Some healthcare providers call it Sjogren's disease. If you have Sjogren's syndrome, your immune system damages glands in your body that produce and control moisture, including your tear system, saliva, salivary glands, nose, throat, digestive system, vagina. Visit a healthcare provider if you're experiencing new dryness in your eyes, mouth, or anywhere else in your body, especially if you're also experiencing new pain or other symptoms. I already read this stuff. Muscle weakness, swollen lymph nodes, fatigue, swallowing, brain fog, focusing. How many you keep saying it. You keep saying about brain fog trouble thinking and focusing and remembering things, why don't you listen to people? Loss of taste. Can't taste. If you can't taste, well, you have to struggle. Like most taste actually comes from the tongue, right? But like you smell it through the tongue. Why do you think snakes go? Because that's how they're smelling things. Don't believe me? Go Google it. Nerve pain, skin rashes. You know, what are they putting in the air right now? And it's causing people, how many people have had an increase in these symptoms since you said that they've been, spraying stuff all over the place? Heartburn or other types of indigestion. Right now, I feel the absolute, bring truth for which also bring acid. I mean, if you, like, I'm not going to take, but I've seen videos where people were taking psychedelic mushrooms, and it was part of to help it was part of the therapeutic thing, and they were puking. I tried mushrooms once. I thought like I was going to puke, but I never threw up. I actually tried them a couple times. If you don't know what you're doing, I suggest you do it. If you're going to do it, make sure you do it and don't use it as a recreation. And light sensitivity. My ex-husband tells me about wearing sunglasses. It's too sensitive to the light. My neighbor, she was sensitive to the light. That's 2 years less. So, yeah, advice. Better go get your spectacles now. I know I have them. I have progressives. Fuck, they're expensive. Well, the weird thing is, they say that most that people aren't both far. Well, why isn't this in specifically in them? And it would maybe continue. I know many people that have these very symptoms, and they've been to years now. They've had CT scans, they've had X-rays, they've had MRIs. Nothing. Doctors send you for these tests. Why are they not for blood work and things like that? Why are they not sending you for this? Because it's the cheapest. No real money to be had with that, right? You said socially not that you set up, So there's my other language again. Oh, that signing's not real, really? Why don't you talk to 3 years? They say that the pobrecito. You saw saying, "Oh, they're bad." No, you have you have false prophets, right? So you have false prophets, you have the false Freemasons, and you have the real true Freemasons. You have the false Templars, and you have the real true. You know, each party works with each other when it's false. Sometimes they'll even infiltrate themselves to get visible. See that? Do you know it's the true Freemasons that's actually, bringing this information to the public, and it's the false ones that are trying to perceive them as being bad because the false ones don't actually know how to do it. Questo è tutto riesce, lei muore. Screwito pure lei. One remember, the other they still didn't understand. Oh, right. That's his little Tinkerbell. No offense, but Tinkerbell wasn't a girl. Here we go with the award. This is no offense to people who are homosexual. Because as I shared it with you before, I'd be a fucking hypocrite if I said anything about homosexuals, considering I had sexual relations with women on more than one occasion too. Ito po rin, Utay. Am I ashamed to say that? Fuck no. Why should I be? That bothers you. Well, that's your problem, not mine. Did I embarrass you? Wow. Don't judge me before you believe. So to all the doctors, you really actually look at that first before you say something. Because it would be actually from the book. How many people have accidents and you bang your head? Maybe it's a selfish I know somebody who's a biologist. Maybe that's part of your problem too. So before you want to look at me like, I don't know what I'm talking about, maybe you should clean your egos out of your ears first. Are you ready to go to your doctor now and speak up and say something? Or are you going to continue to be told, yeah, you have say over what takes place, but yet you don't? Next time your doctor says, you have some ears, nose, and throat specialist, why don't you say to them, why don't you send me to a rheumatologist? See what they say. And then bring up that disease. Seriously. Don't judge a book by its cover. You never know what's inside until you actually, because there may be some pages you never see. So with that being said, I'm sending you all much love, light, many blessings. Want you all to be big, bold, brave. Most importantly, be yourself. Be your authentic self. Be kind to yourself, and don't be afraid to ask questions. Because I'll tell you right now, if they snub you for asking questions, that's when you wonder what do they have to hide. Send you all up. Recita por eso le doy. And happy, very nice.